Hi, it's Dr. David Greene, founder and CEO of R3 Stem Cell, the global leader of regenerative therapies. Today, we're going to the whiteboard, and I'm talking about autism outcomes. All right? In India, we offer autism stem cell therapy that has been tremendously successful at our centers around the world. All right? Now, when parents come to us, usually they say that they've already tried behavioral therapy, speech, maybe the keto diet, right? And they've tried all these things and they're not working. They're not working good enough, all right? So they want to hear about stem cell therapy. They want to know what they can expect with treatment for their child. So we see improvements in over 85% of children that are very noticeable, okay? What do those improvements look like? Well, there's two categories, all right? One is in behavior. The other is in communication. Now, what does that look like? Well, a lot of these kids with ASD, as I'm sure you know, have various issues. They're hyper, they're aggressive, there's no eye contact. Well, that's more with communication. But those are the main two things: hyperness, hyperactivity, and aggressive. So, and it's various, levels of severity. Now, with the treatment, with the stem cells, patients, the children typically get less hyper and less aggressive. And that's usually dramatic. Okay? I'm not saying it's going to be eliminated, but usually, according to the research and our experience, it's nicely reduced. Okay? And also, when it comes to communication, a lot of these children, they don't speak at all. Or maybe they speak, but they're just mimicking what they see on YouTube or some video, right? So, with the treatment with the stem cells, we typically see better eye contact. So increased eye contact, better attention span, and then increased vocabulary, and increased non-verbal communication. I'm not going to write out communication, you get it, okay? So what we're not going to sit here is promise you that your child who doesn't speak is going to get a vocabulary of 5,000 words. It's just not realistic, okay? But time and time again, we see where children who are not communicating start improvements in one of these various categories, and it's usually very noticeable, and it's lasting, okay? So, 4 to 6 weeks is the typical time frame when parents tell us they start to notice improvements, and then it continues to get better and better for months. And then usually baselines after about 6 months, okay? 2 out of 3 families end up opting for their child to get a repeat treatment. And then it's one of these things where here's the baseline, you get some improvements, gets to a new baseline, you get another treatment, get to a new baseline, and then so on and so forth. But it's not mandatory, right? That's up to the family. All right, lovely handwriting. There you go. So visit us online at r3stemcell.com/India. Lots of educational information on there. You can call us for a free consultation at the number on the screen. Thank you for watching.